Hello everyone. So I think the Interact Club of Burhani Serendib School has actually decided to do a sort of an awareness on cancer. So basically we've got four doctors, including myself, Dr. Osama, Dr. Raj and Dr. Vohara, who will be answering a few questions that were posed by you all via Instagram. So just an overview of what we will be doing and what cancer is. It is something that has created a sort of feeling for a lot of people. Do I have the possibilities of getting cancer? Are people whose parents who have had cancer, is it possible for their children to get cancer? So these sort of common questions we have answered via this particular session. Also, I think it is very important for you to understand that nowadays we have treatment options. Even if you're diagnosed, there are treatment options that can completely cure you, which we like to call radical sort of treatment options, where you completely remove the tumor and then we as doctors can completely say that you are completely cancer free. But the problem we have in Sri Lanka is that our detection rate is not as good as the developed countries, and that is the reason as to why we feel that we are lacking when it comes to treating patients with cancer. Because when we treat patients with cancer, they've already come at a stage where patients have already developed a sort of a tumor, and that tumor has spread to different parts of the body, and at that particular time it is very difficult for us as doctors to give a radical sort of treatment. Therefore we go into these palliative sort of things like chemotherapy, radiotherapy. And therefore I think what we need to learn through this session is that get yourself checked. If you're a female more than 35 years old, learn how you can do the self breast examination. Very simple. You can go into Google and they have all these different images where you can actually check if you got any lumps, right? If you are in the stages where you're getting, if you're a female and you're having intermenstrual bleeding or something with regard to your reproductive health organs, get yourself checked by a gynecologist. For males, I think one of the most common sort of cancers tumors is with regard to the prostate. If you're having difficulty in voiding, if you're having a cough that is not actually getting better, right, it has been there for a long time. If you are a smoker, if you're smoking cigarettes, if you're smoking BD, if you're a person who's actually constantly having areca nuts, bullet leaves, beetle leaves, and you're having difficulty in swallowing, all of those are things that you need to promptly go to a doctor. Don't try to treat yourself with all these herbal medications. Get yourself checked. Make sure that you're not having any possibility of all of that, because when you get yourself checked early, and if we can detect it early, we have a higher possibility of making sure that you leave the hospital or you leave the clinic with a very happy face, because of the fact that by yourself that we've caught it early, we've treated it early, and therefore there is a very less chance of it coming back. So hope you enjoy this, and again kudos to the Interact Club of Burhani Serendib School for doing such a thing, because awareness is what is very important, and apart from awareness, prevention is always the best sort of treatment, and this is a sort of way where we can prevent a lot of people from actually having to deal with cancer in such a way that it can prove to not be as beneficial as getting it early. Thank you.
What is cancer? Cancer is the uncontrolled overgrowth of the cell, which doesn't have the control of it. Usually, it's, for example, if you have a wound, the wound heals by cells growth, which has a control. So, with the control growth, the wound heals. But if the cells don't have any control, and if they overgrow, and then if they exceed the limit, they can proliferate, or maybe they can grow in numbers or in size, which can be turned into cancer. So that is basically cancer. That's a simple definition of cancer.
Essentially, cancer is when there is an abnormality or a faulty gene in our body, which causes a massive growth of the body cells, which leads to the formation of cancer. In a normal person, in a normal healthy adult, if there is a faulty gene, it can be detected by the body and it can prevent the further consequences from happening. But what if you are at a higher risk of having cancer, for example, through acquired factors or through inherited factors? Your body might produce a defective gene which won't be detected and fixed by your body, and thereby cause an uncontrolled growth of your cells, which in turn leads to the formation of a tumor, which can spread through the body and cause cancer. The question that I have been asked to discuss is whether cancer is genetic. And with the advances in molecular biology and genetic studies, we are more equipped in answering questions like these, because it is a very, very important question that we need to understand. Cancer is basically and essentially a genetic disease which can either be acquired or it can either be inherited. What do we mean by acquired? An acquired mutation means that there are certain lifestyle factors and certain environmental factors that can cause a mutation in your genes. What I mean by this is, there are certain examples such as UV light, such as radiation, exposure to radiation, which are environmental factors which contribute to mutations. There are lifestyle factors that cause these acquired mutations that I'm talking about, such as tobacco, smoking, alcohol, being overweight, having terrible diets. So these are basically the contributing factors to acquired mutations. When we are exposed to a prolonged period of these environmental factors or bad lifestyle factors, it can stimulate our gene to multiply and have a mistake. We call that mistake a mutation. Usually our body is able to identify it and handle it, basically, speaking in the layman's terms. However, there are some people who have the inability or a reduced chance of fixing it, and these people are at high risk. Now, this risk actually comes with, as I mentioned before, the acquired mutations, or it could be inherited factors as well. So when I come to the topic of inherited mutations, we all are aware through, let's say, pop culture or the movies that we see, that cancer can be passed down from one family member to another generation of a family member. And we are very aware of very popular examples such as Angelina Jolie, a renowned actress in Hollywood, who had a faulty gene in her body called the BRCA1 and BRCA2, which in the end needed her to undergo preventive surgery called double mastectomy, where she surgically removes both her breasts to reduce the chance of acquiring breast cancer. So getting into this, basically, around 2 to 10 cancers in every 100 cancers is inherited. That is, basically around 5 to 20% of all cancers is inherited through family, which is actually a significant percentage. But remember, just because your family member has had cancer, that doesn't mean that you are a definitive candidate for cancer. Keeping that in mind, it is very important to be aware of your situation, to be aware of how high of a risk you are at of getting cancer if your family member had cancer. There are certain factors that the NHS of UK has recommended in upping your game in doing genetic screening. For example, if you have had 2 or more family members who have had the same type of cancer, or if you had a family member who developed cancer at a very young age, or who had a family member who had 2 types of cancer in their body over the course of their life. So these things increase the risk of inheriting cancer. But like I mentioned before, it doesn't seal your fate on getting cancer. So let me stress on one of the types of cancer, breast cancer, which is one of the most common forms of cancer in developed countries and developing countries. I think you've heard about this gene, as I mentioned before, the BRCA1 and the BRCA2 genes. These genes are faulty genes, and the presence of these genes increases your risk of developing breast cancer. There are several types of genetic markers, which is the term that we use, that will help us identify that this patient is at a higher risk of developing cancer, which I'll get to later. So let me focus on the BRCA1 and BRCA2. If you do have BRCA1 and BRCA2, that increases your risk of having cancer. However, there are several measures that you can take to actually prevent yourself from getting it or detect it at a very early stage.
So what I'm going to talk today is regarding stages of cancer. So when you talk about stages of cancer, we have different stages or ways of classifying it. One of the commonest way of classifying is the TNM staging. So basically TNM staging, if you are going to tell the full form, T means tumor, N means node, and M means metastasis, which is basically used, we use it in order to classify a cancer and thereby, to aim what sort of treatment we are going to give to the patient, and so that we can come up with a good prognosis for the patient. So let me start. Basically, we start from stage 0 up to stage 4. So when you say stage 0, that means it's known as carcinoma in situ, which generally means that there are abnormal cells within the, say the breast, when you say there are just abnormal cells, but you can't find any sort of lump or anything on your breast. So the only way to identify a carcinoma in situ is going to be doing some sort of investigation like scanning or CT scanning or something like mammogram or MRI. Then you go on to stage 1. Stage 1 is when there's a small lump, where say a patient, say it's a breast cancer patient, will come running to you saying that there is a small lump on her breast. So that is during when she's having a wash or something, she comes across a lump on her breast. So that could be the only first sign that she could have had, and this sort of cancer is called the early stage cancer, and we also call it as a localized cancer. And basically they have a very good prognosis, and if they are treated at that stage, basically the patient will recover very quickly. Then you say stage 2 and stage 3. That is when the cancer becomes growing and becomes larger, and when they start invading the nearby tissues and lymph nodes. Say a person with breast cancer, initially the stage 1, which I mentioned before, is a small lump, but when it starts invading your lymph node and the skin, the whole breast could turn into an orange-like structure called the pearly orange, or it could spread to the lymph nodes and surrounding tissues. And then you finally go to stage 4, where the cancer starts spreading to the rest of the organs, rest of the body. Basically, it can go to the liver, it can go to the lung, it can go to the bone marrow or the brain. So this is how you can classify these stages of cancer. The most important reason for staging of this cancer is basically to aim what sort of treatment we are going to give to this patient. Stage 0 will have one sort of treatment, stage 4 will have one sort of treatment, and according to the stages we can say, okay, a patient comes with stage 0, he will survive so and so years, but the stage 4 he will survive only for a smaller duration. So that is how basically we classify the stages of cancer.
Okay, so we are going to be discussing cancer and its cures, and if there are any cancers that are not curable. Now basically I'm sure Dr. Osama has actually explained to us about the staging of cancer, and according to the stage, they usually, according to the initial stage, the localized stage, there is always something there where you can actually remove the tumor and you can say that I have cured this particular patient. But there are some cancers, if they spread, for example, again taking the same example that Dr. Osama has brought forward, a breast cancer where it has metastasized to the lymph nodes or to the lungs or the brain, then in that particular situation, it is absolutely impossible for us to actually give something called a radical cure for that patient. For those type of patients, what we use the term called palliative care. Palliative care basically means tender loving care. For those patients, we actually just make sure to symptomatically treat the patient. So if a patient who has got some cancer that has spread to a lot of other organs, that patient has not a lot of time left, and therefore it is our duty as health workers to help her ease out with the pain. If she is persistently vomiting, we help her out with reducing the emesis. So these are the things that we do for those type of cancer. Generally, as an end statement, all cancers have a cure. It all depends on how when or how early we detect it. The problem in Sri Lanka is the detection rate is very, very low. Whereas when you take the countries such as developed countries, it is absolutely twice-fold as compared to how much we actually detect in Sri Lanka. Now, in my experience, when I was actually in Balapitiya-based hospital, cancers that we always got were always late stage. Like Dr. Osama said, they always came at a stage where it had already shown external changes, skin changes. It had already spread to the lymph nodes. It had already spread to the lungs. There were patients with breast cancer who were coming with cough, with respiratory symptoms, with symptoms of lung symptoms, and that's how we detected that these patients had breast cancer. So it is my duty for me to inform you all that it is absolutely important that we take an active role in figuring out whether there is a possibility that you have cancer or not.
So the next question that I've been asked to talk about is, how do you prevent cancer? That is just as important as the rest of this program, because this is essentially what the program today is about. Like I mentioned before, since there are two ways of getting cancer, it could either be acquired, it could either be inherited. Let's try to focus through that and how you prevent it. If you are going to focus on preventing getting acquired mutations, that is through terrible lifestyle choices or from being exposed to environmental triggers. Basically, avoid being exposed to radiation for a prolonged period of time, avoid being exposed to UV light for a prolonged period of time, and at the same time, really try to up your lifestyle game. Maintain a really healthy diet, avoid all, basically throw all the junk out the window. Also, avoid smoking, because that is the number one risk factors for getting any and all kinds of cancers. Limit your daily intake of alcohol, maintain a healthy diet, regular exercise to prevent being overweight, and also there are some medications like your contraceptive pills or hormone replacement therapy, which can increase cancer in certain patients. So these are the lifestyle factors, and focusing on the factors which can contribute to inherited cancers. I think the best there is a lot of theory out there, but let's just take some examples. I think everybody knows about Angelina Jolie and her path to preventing women from getting breast cancer, because she got a positive BRCA1 and BRCA2 gene, and she underwent a double mastectomy surgery, surgical removal of your breasts. So just remember that there are certain, we call these preventative surgeries, which can actually reduce the risk of getting cancer. For example, double mastectomy that I just spoke about reduces your risk of getting cancer, breast cancer, by 90%. And there are some ladies who remove their ovaries just before menopause, and that reduces their risk of breast cancer by 50% and reduces risk of ovarian cancer.
Now let's discuss about what type of cancers are more common. So first of all, in Sri Lanka, the most common cancer is oral cavity cancer. Why is it? Because of the fact that a lot of people in Sri Lanka chew betel. But it's not the betel that's the problem, but it is the areca nuts that are in the betel leaves that are the problem. Those are actually having the potential to cause these faulty genes and carry on with this pathogenesis and increase the risk of oral cavity cancer. Right? So you can have the maxilla bone that can go, so that is the most common cancer in Sri Lanka.
The signs and symptoms of cancer. So basically, when a person comes, he will come complaining of certain things, he will tell certain complaints. So what he's going to complain of is going to be the symptoms, and what a doctor or physician sees is going to be the sign. So say if the patient is having a brain tumor, he will come complaining of headache, which is not responding to treatment even for more than 2 weeks, and he's also going to complain that he's going to have early morning vomiting, which will resolve the headache. And further, then you calm down, you take the oral cavity. There will be lesions in the gum or in the teeth or in your chin or inside your oral cavity, which will not heal despite you give any sort of treatment for more than 2 weeks. And then you go to a person who is having carcinoma of the esophagus or esophageal cancer, he will complain of difficulty in swallowing. And then you take a person who is having a lung cancer, he will come with difficulty in breathing. If you have persistent cough for a period of more than 2 weeks, he'll be coughing blood, he will be coughing sputum mixed with blood, things like that. So if you come to the abdomen, or if there is any lesion in there, any sort of cancer, say your stomach, or there will be loss of appetite, difficulty, loss of appetite and loss of weight will be one of the most common symptoms. Then later on, when you come to the small intestine, large intestine, he cannot process the food properly, so there will be altered bowel habits, like he will have constipation for a few days, he will have diarrhea for a few days, symptoms like that. So a particular symptom, with one particular symptom we can't diagnose where exactly the cancer is. So the symptoms which a person will present is going to be vague. So sometimes the person will come, like I spoke before, different stage, say stage 4 of the disease, where he has got a breast cancer and he has spread to the lungs. So he will come with symptoms such as cough, sputum, hemoptysis, that is called blood mixed sputum. So things like that. So we can't say, we'll have to investigate to find the first focus, that means where the cancer has initially started in such type of people. So basically, one of the most important thing is a person who has cancer can present with loss of appetite and loss of weight, with our more common symptoms in a patient with carcinoma. Any age in which a person is more prone to get cancer. So there is no exact age in which a person has a possibility of getting cancer. It can come in early childhood, or it can come in your late stages, or when you're very old. So if you take early childhood, like any blood cancers like lymphomas, leukemias, so a child could get it very early. Or in late stages, like say a person who has been smoking too long, or he has been having bad lifestyle practices, he could get carcinoma of lung at a different stage. So we can't say at this particular age, this person is more prone to get cancer. But certain cancers, like a breast cancer, you say if the person keeps on examining and doing self-examination and all, he can figure it out at an early stage. So we can, so that is what you can do. Basically, we can't say one particular age at which the cancer is more prone to occur.
Is for cancers. So cancers can be treated in various ways, but it all depends on where you have the cancer. So basically, if the cancer is originated from an organ, so you can remove the organ, so which is the surgical modality. But if the cancer is coming from blood, so you can't remove the blood. So what you have to do is you have to stop the proliferation, you have to stop the growth of the cancer. So basically what you have to do is you have to give some toxic which kills the cell. So basically that is called chemotherapy. So it's a chemical therapy, that is chemotherapy, which is a normal toxic for the cells, which kills the cells. But the thing is, there are side effects. It can kill the cancers, but it can also attack the normal cells. So that's why you have, you lose hair, you lose the skin, you lose weight. So that's one way of modality. And there's something called radiotherapy. So basically, radiotherapy means that is also it's a toxic for the cells, which also kills the cancer cells. So that means radiotherapy you can direct towards the cancer cells and you can kill it. But the same way the chemotherapy works, the radiotherapy also can kill the normal cells. There are a lot of side effects.